Yeah, what I did at the base, at the occiput on Griselda, what I did was I took my thumb like this, flat, and I just hooked right at the base and then was pulling in the opposite direction.
Oh, okay.
So with this thumb, it's like you hook here and then pull back. And they get a sense of length from like origin to insertion for levator scapula there. My first comment on Twitch today is like, what the hell did I wander into?
Oh, so that's what you have up now?
Yeah.
Because I haven't been able to watch your lives of what Twitch and all that is just yet.
You know, Divine Serenity, if you got people who are inflexible, either you as a giver or a receiver, I think table tie is a good place to go. I think people overplay flexibility in Thai massage. You don't have to be very flexible. I think you could still do mat work as well, and what you'll find is if you're doing mat work, you're going to become more flexible as you do it. In addition, I think that the clients become more comfortable as you work with them and are able to lengthen more easily. It's not so much stretching as it is giving length to various muscles at different times. When you work at it consistently on a table and on a mat, your flexibility will also increase.
Show me the jostle again. How you were doing it at the very beginning. Yeah. Because you're trying to warm up and loosen up.
Oh, the jostle.
Yeah.
So what I did, and again, it's like, there's a lot of stuff that I've built up over time that I don't think about, I just do it. Because if I came in and she'd never worked with me, I'd be like, okay, come on. You laugh, it seems funny, but I pointed out just to be sure. Because I came in first and said, hey, what, you have problems with your upper back and neck here? Okay, and then is it always like up here?
Yep.
Okay, right in there. Oh, yeah, okay. And then does it go up to, towards your neck? Okay, and then I can kind of lengthen between the two. And then, all right, cool. Yeah, right in there. Feel straight on the shoulder. Then I can come in. Oh yeah, you don't have to keep on. Is that too much?
No.
Now, when I lean, here's another piece.
You were actually doing good. It feels exactly what you said.
When I'm sitting here and I lean down towards the tailbone, that's a different angle than if I'm back and opening the chest. The angle is gonna change. The movement that I use is gonna mobilize and lengthen different muscles.
Pivoting.
So when I tell clients I'm gonna move you around and find out where we're gonna work, because I'm looking for a movement restriction.
How's that feel?
I'm looking for something that feels tight.
So it's the same movement, just a different direction. So it's isolating different muscles.
Yeah. No, not at all. Yeah, no, it's actually more like almost kind of opening up. So it's pressing the hand down there, like going that direction exactly. And just there.
Are you using knuckles or fingertips?
It's just easy on you, like the massage like this. Not at all.
Well, just looking at your body.
So Dana wanted more length on her neck. They took out the bolster. Her head lays over on its side. She gets more length to her neck muscles. Everyone's going to be a bit different. If I'm going to have them here for a while, I definitely want a bolster. But in her case, that feels more comfortable. You can just check in with the client.
Yeah, exactly.
feels
So
awesome.
right in through there.
Yes. So this one's pulling out.
Yeah, so that's opening at my chest.
Too much or it's okay?
Now it's
Yeah.
good.
And then do you feel pull towards you like this one? Do you feel like that
Exactly.
different?
Oh, no, Robert, you got a cat?
No, not at all. It just feels like a good,
Why?
good base.
I can't tell if it's my outside or outdoor.
That's open.
So we had my roommate that just moved out had a pit bull. He had short hair, but no cat. No cat.
Yeah,
I have
really
plants
feel
that they die, compost.
That's good.
I don't feel bad about
That feels really
it.
good.
This was once one pothos. It keeps like I don't know. It's like little shot pores or anything. It keeps growing.
That was good. Oh, that's, I'm all excited.
Usually it'll fit right between that border between the shoulder blade and the shoulder.
I know, that's what I was gonna say. You go.
You want me to go?
I'll do.
Do you see for circular
Let me show you,
movements?
which is what he was saying, yeah.
Okay.
So do you sort of like,
It's challenging to figure, like what she said, do you do circular movements or you do jostling? And I think there's a high degree of variability based on the person I'm working with and what's going to get Alan to relax and let go. Some people, if I come in for a real robust movement, they go, and I go, oh, okay. So I slow down, and do it much more slowly. Go.
Do you want to switch again?
Cool.
okay.
And then as we continue working, I'll just get kind of a sense and a feel of what's helping him relax, what is he like responding well to, and keep giving him more of that. And then if I need to, ask him for verbal feedback. Do you want the Brita filter? Okay. Well, round water is the delivery. If you go through there, and in the kitchen is a filter on the faucet.
Okay, thank you.
Again, I just really gonna
Yeah.
Yeah, asking. So long term, what I do is to give you more tools. You're a mechanic, I give you a big wall of tools, and go, here's some more tools. Here's a jackhammer. Da, 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 da.
So here's
Yeah.
just stretching out the.
What you do is you just pick the appropriate tool for the appropriate client. What I can't do is I can't say, do this. And in fact, we said circular motions and a jostle. According to science, which is more effective?
I guess it would depend on the client here.
That's exactly what I've been trying to educate students on. They get very angry when I tell them. Go screw yourself. I'm like, why do I feel that? Probably nerves.
I don't tell me where
But the thing is, they're asking for like more detail. And it's like, it can sometimes be confusing because if I'm giving them all these tools, they're like, well, I don't know when to use what. And it's like, he's going to respond to different stuff.
Right. Not techniques.
Yeah, it's like, that's the line between like the art and the science. Like, it's still much more.
Even if you say, hey, so this is why I'm doing this.
Yeah, so now I found that I start them face down.
Yeah.
And I do body compressions just along the low back and glutes. I just do some about 10-15 minutes of compressions on the glutes. Then I turn them over and do the low back stuff that Robert's talking about.
Sometimes I'm like.
Much better response.
Yeah.
And they're really better.
Yes.
Because I've touched their leg.
Yeah.
I've done the routine.
Definitely is
They feel me.
restriction without the.
So when I come in,
You're kind of explaining as to why you're working their way back.
It's like, you know.
and sometimes they'll ask, like, so why are you doing this? And I'll raise the judge feel. But most of the time, they like to tell me about their age. They want to know why they were thinking about their spouse or whatever. Joke around, whatever they have going on. They're really curious what I do, as long as what I'm doing.
Exactly.
But I will test them pretty much on that.
So, to me, that felt
I'm not saying on that.
Right.
but overall, it's like.
Just having a vision of this much exploding.
It's not too fast for you person. Can you go slower?
This is right, right? Yeah. So because you're a little taller, you'll be down more towards the sacrum, yeah. Okay. Forward though. Because you had to lean forward to grab her.
So
So you want to get a comfortable grab and then lean backward. Go back to you.
Okay. Yeah.
Not really feeling a stretch. There we go.
I just wanted to go slow, right?
Cool. Awesome.
What do you think to
It's more like here to here. Yeah.
people in the West,
Guess that's what you
what do they think Thai massage is?
I think her.
Somebody walking on your back?
Yeah.
Somebody walking on your back. Why do people in the West think Thai massage is somebody walking on your back?
What you can do is you can use one time.
Asian thing?
So right here.
What was that?
Because it's an Asian thing?
It's Asian.
Eastern medicine.
Yeah, that's right.
I mean, no,
I've seen bars on the ceiling and people walking on, you know.
Isn't that shiatsu?
That's shiatsu?
Yeah. Although Robert, I'm checking out your suspension system. I could totally do that in my office.
That's what I was thinking. I could take them out everywhere. I don't know if I can.
I was practicing with a friend the other day and I fell off of her. And she's like, "Are you okay?" I'm like, "Yeah, fine."
So, if you sell it as Thai massage, if you put, like when you leave class today, have you had any other Thai massage training?
No.
Okay. Are you going to put Thai massage on your menu of services?
What would you call it? I mean, probably
Really fucking good body work. And that might sell, depending on your client, whether they can deal with the F word.
right, because there's that
Just
cultural bias.
RFB.
And that's
generalization.
and here's one of the things that'll frustrate me the most. Like with Griselda, occasionally I'll have a student of like Asian ancestry who's like Vietnamese or Thai or whatever. It's like, dude, if she puts Thai massage on her menu of services, what phone call is she gonna get? Guys, I don't know what's up with men in our culture, but they're pissing me off. And like, I thought, because I walk around in my daily life thinking men are like me. Apparently they're not. Because I've been seeing shit in my Facebook feed that's been making me want to light a fire. Yeah. Somebody contacted, because Wendy runs the Thai Massage Jam and Clean. Guy contacts me through the Thai Massage Jam page, says, "I love Thai massage. And I'm in Colleen." I'm like, "Oh, he's like, "Do you know somebody?" I'm like, "Yeah, Wendy, whatever." And I just real quick, because I'm got clerical, right? I pass him along, and she's like, "Yo, the guy was looking for a hand job." And I was like, "Oh, I'm sorry. He didn't say." And then she blocked him or said some foul words, and then he contacted me and was like, "Hey man, I'm sorry. I don't want to make anybody uncomfortable." And I'm just like, "Get out of here." Like, that's not.
Man, I could have made it quick. He hit 350 though.
So that's part of the challenge in what you call it. What we're doing right now, just this one little thing we've done. In consumers' minds, what is this?
Stretching.
Yeah.
Stretching.
Yeah.
There's more mobilization generally. Sometimes I even get away from saying stretching because everybody's Thai massage, stretching, 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 Instagram, stretching. It's visual, you can see it. How aesthetically pleasing is compression?
It's not. Pretty boring to watch.
Yeah.
It feels great, but it's pretty boring to watch.
My practice, I spend more time in basically what people think of as compression than I do anything else.
How's
How's that feel?
More than mobilization, more than lengthening, more than stretching. But it's people's preconceived notions.
I think to answer your question, I feel a little bit of an aversion to calling it Thai massage just because people are going to create their own impressions like right off the bat.
Because they don't know.
Right, and also they don't
Yeah.
want to see it, they think it's going to be something else. And I would go out of their way
Because they
to
feel like there's like they've only got so much massage money. Why are you trying to do this weird? It's like, no. Which is why I really go with the table-based soft stuff. You just add to it.
Because the body's going, you're going to feel the stretch to your body.
It's like Thai massage.
So another way to test
I
it
know, I know, use your feet.
this way.
And you can't.
I literally had somebody, I was like, I'm going to go take a table class, and I'm like, is that where you
Oh, from a marketing and branding perspective, there's a lot of caveats. And I continue to refine that because if you use language effectively, it's easier to sell. If you sell what they want.
That's what I mean.
Everybody's flexibility is going to be super different too. I do a lot of yoga. I'm also a former ballet dancer.
Well, roll her more this way.
So, Nick, you go by Nick, right?
Now, hold her more.
Do you work for yourself?
Yeah.
Okay. You have a website?
Yeah.
Okay. Here's what you got to do, Nick. I'm a guy. Okay, I've worked. How long have you worked as a therapist?
3 years now.
3 years.
I mean,
How old
it's
are you?
stretching, but it's not
27.
painful.
27.
Right,
Okay.
and we
So
don't want to
remember,
be-
like I started around 25ish, something like that. So similar. Here's what I need you to do very quickly. I'm willing to do this for you. Okay. I have video equipment. We can shoot videos for your website.
Okay.
We can shoot a couple photos for your website. It'll take you 10 minutes to do that.
Yeah, yeah.
You need photos on your website of you working on women that are clothed.
Oh, that's a really good idea.
And you need to feature in your website,
Oh.
hey, I'm Nick. I help people in pain, or what do you focus on primarily in practice?
Sports massage and pain reduction.
Sports and pain reduction?
Yeah, pain
Yeah,
reduction.
listen, I'm Nick. Is Spaghetti? Does that sound right?
Yeah.
Yeah. I'm Nick. I help people with sports massage and pain reduction. Working on a woman, an athlete, you give them a little, 30-minute session for free for, doing the photo shoot or video shoot. You put that
Yeah.
front and center.
That's
Because
a
when
really
people
good
hit your
idea.
website, they go, oh, wow.
And I could do that with a man.
Exactly.
Because I don't want, I've quit working on men because it got
See?
too hard for me.
And then the thing is, like, it makes, shit. Well, our culture is fucked up. How about that? I used the F word again. And that's the thing, like, we're trying to create a better situation, but clothes on is another option.
Yeah.
And if you want to focus on that, then that's like a good way to deal with it. What it helps you do very quickly is build like a stronger rapport with the potential clients.
Yeah. No, that's a genius idea, actually.
That was in Kelso. That was like 10 years ago.
Don't tell him that.
But it's not like it was my idea. Like I created it out of the blue.
Oh, that was really good there.
Are you feeling you're gonna overinflate my ego?
A little bit, yeah.
Yeah.
That's really
Robert,
yeah.
if I'm gonna work with somebody, just do the same thing.
Absolutely.
Okay,
That's
that's
what you
what I
want
was
to do.
doing.
So here's what I want you to do. Loop your arm underneath. Grab on the shoulder here. So I want you to hold the shoulder here, and then I want you to like reposition your hands or potentially separate the hands. And then one hand that goes into the pad. Now change the leg.
That's what I was
The
doing.
reason I didn't do that initially is I'm getting to know myself. I wouldn't want to reach into her pecs initially because I'm creating. 30 minutes in, she's like, oh, it's fine. I know what's going on. And that's a much easier situation for me to go in and work on this. As a female therapist, it's a little bit easier for you to deal with that. Whenever I talk about drape in this class, I have a student and a teaching assistant colleague.
Yeah.
She offered to like come in and have me shoot video about drape, and I'm like, why? She's like, they need it, and I'm like, why? And she's like, because it's massage, and I'm like, no, it's not. Like, the idea, to me, it feels like I'm going backwards if I'm trying to teach drape, because I'm like, I don't. Because here's what women in class do. Women in class always go, like I'll show this crazy leg lift switch, switch, flip them over, and they're like, oh yeah, you can totally drape this. You ladies are taking the sheets and like wrapping them around. I'm like, not me. No.
It's too much work.
It's like I felt like I could focus on good work or I could focus on drape, but I couldn't do both.
Yeah.
Because here was the problem.
I started doing all that stuff that I was straight before with their clothes.
Especially
Before I
with
started
new
stuff.
women clients. Here was the deal. If you got a breeze, you were naked. And they felt uncomfortable. Doesn't matter if I could see anything.
Right.
So having a clothes on option was a big boon for me. Now, with what we've shown so far, just this, can you do this draped?
Yes.
Oh yeah.
Over the sheet blanket, it's just wrapped under their arm, you come and sit down, totally fine. Where is this? Alfred? Alfred, do you not know who I am? I'm Robert Gardner. We're in Round Rock, Texas, Alfred.
And you want coffee?
He has, he's live streaming this
In
right
my
now
home
on
studio.
Twitch. Yeah. So,
No,
You have to taunt the audience every once in a while.
Just poke them. I'm so glad I did this.
Yes. I've been wanting to do this for a year, ever since we started.
yeah, I teach my students table tie, but I also teach them how to do it with the client draped in case they go work someplace like Massage Envy or Handmade Styles and they can't have a mat, but this way they can still do some of the work on the table.
Yeah.
But the client's still getting
A lot
the
of-
traditional massage.
I think what I'm teaching you in these 2 days can be blended into almost any session. Mat-based, table-based, chair, whatever. A lot of it depends on packaging and marketing and like the verbiage you use. Like for him, he likes sports stuff and pain reductions. Perfect. So, and then what he does over time is he slowly tweaks his image. Because if he does this and then he wants to start doing that, what he does is he switches out videos. He shows a table-based video, oh, okay, I'm comfortable. He shows a mat video and they go, oh, well, there's something different. But you see how if I put the mat video first, they're kind of like, ew, what? I want a massage, what the hell is this? Do you see? You have to learn how to use language to sort of craft what it is that you're selling, what it is you're packaging for clients.
Okay.
And if you need to, just scoot them over. Okay.
Are we ready for more?
Yes.
Do you want to receive this since you're right here?
Yes.
Put whatever side is problematic.
So, trying to find a room to rent in Austin is like.
And the location you need to, right? You gotta keep.
Yeah.
I'm an hour north of Carpal, so.
I'm gonna, just for this, I'm gonna change it.
Yes. Well, I live there. Right.
That was without the.
Yeah, a lot of military people are coming.
All right, so we started with what I think is a more conservative version because I'm dealing with a massage client. A massage client who may have not worked with me before, they don't know me, they don't know what's going on. Hey, what's your name?
Deanna.
Deanna? I was like, hey, Deanna, take off your shoes, lay down on the table just like you are. I want to move you around to see where we're going to work in your upper back and neck. I would have done the stuff that we just covered, that one little first movement. And then I'm going to come in again and just mobilize her. How's this?
Good. Good.
Do you usually like pressure?
Yes.
Oh, this right here. So when you have problems with your upper back and neck, does it always seem to come from here?
Yeah. Traps.
And I'm just feeling my way around. This table's really low. This is going to be easy for me, okay? What I'm going to do, she doesn't know this, I'm going to slide off a shoe. Who worked at Massage? Griselda, you work at Massage Envy. Does anybody else work at Massage Envy? No? Massage Envy has a rule. You've got to keep one foot on the floor at all times. You got fire. You're sitting on the table. Fire. I'm going to come in and give some length here. I'm going to slide off my shoe because I'm going to bring my knee right in there. How's that?
That's great.
Now, at the same time I'm hooking with my knee, I'm going to lean into her arm here. Oh, baby. Oh, why are they making you kill your forearm extensors? If I take you right there, how's that?
That's great.
Now, I got 3 points of contact and 1 foot on the floor, Massage Envy. Tell me what massage is. So I can lengthen and give a little more like pin and stretch to this, but I can also slide along her forearm extensors and kind of work those out. How's that? Because her forearm felt pretty tight there. Is this too much pressure?
No.
Now, you'll notice I didn't say, is my hand too much pressure? Is my knee too much pressure? She doesn't know what I'm using. She's looking over that way. Kinesthetically, go, hey, is this too much pressure here? Is this too much pressure here? Is this too much pressure there? Make sense? Kinesthetic cues. How's that right there?
Good. That's great.
Posterior neck, levator scap, trap is mostly where my knee is. You're going to have to figure out how your body can fit into this. I'm going to show you a more conservative option as well. But because the table was so low and I thought she wanted a little more pressure, that was going to work. How's that? That's better?
Yes.
There we go. So I gave her a choice. I just changed my angle, kind of vector of pressure. I leaned in. You like that better? There we go. How's the jostle?
It's good.
Do you prefer static or jostle?
Static.
Static, right there?
Yeah.
Okay, now what if I roll you back and open that way?
Does that hurt?
Then when she says, do that again. When she goes, awesome, do that again. Why is it when you say awesome, the therapist goes, good, okay, now work on your feet? I don't understand that. You ever have a therapist that does that? Like, as soon as they get into something good, they go, okay, good.
Because it also means you fixed it.
Right.
You're
Moving on.
Yeah.
Now, it's important to note that I'm not in the front of the neck, right?
Yes.
Like, I've posted photos or videos of this, and people will lose their minds. And they're like, you're on your carotid artery! I'm like, I'm not on the carotid artery. Like, I'm in the back.
Why would I do that?
I'm right back here.
I had
Would you have any fear of putting your forearm and elbow there?
No.
Then why would you have fear of putting your knee
Right,
there?
yeah.
And the thing is, how big is this compared to your elbow? Big, bulky. Well, you got a 300-pound guy. You drop the table low. You need bigger tools than this,
Yes.
right?
Okay.
So let's say I wanted to give her a little length afterwards. I'm just going to come in traction. I'm grabbing up above her wrist. If I just grabbed here and went yank, how's it feel on the wrist? Yeah. So it was like I kind of grabbed above and below. How's that?
That's great.
Oh. 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 Very angry bee. Oh. Now, do you prefer this angle?
Oh yeah, that's great.
That's
too.
good? Okay.
Yeah.
So to block her, because I'm not seated anymore, I'm going to put my knee right in her glute. I'm not really putting a huge amount of pressure here. I'm using this to stabilize because I don't want her to feel like she's going to fall off the table. Oh my gosh. How's that? And this also gives me a chance just to see like what's her range of motion through her shoulder. What's going on through here? Ooh. Ooh. How long have you been working?
Just a year.
Just a year? Oh my God. Ugh. Do you do a lot of knitting, playing guitar in your free time?
No.
Tight in there. Now how's the knee over here?
Good.
Good. You want more pressure there?
Sure.
Sure. So I lean in here. How's that?
Good.
Okay. Now I lean in a bit more. How's that?
Outside.
I go, oh, what about her hand right there? Oh, that feels better. Now, could you do this draped? Yeah, absolutely. Absolutely. I just wanted a little bit of like length after doing a compression. Here's what will happen. If you learn to use compression well, you'll lean on it sometimes. And if it's compression, Alan's like, dude, could you just give me a hug every once in a while? Like, I don't feel very supported in this, you know, trying to chip away. Like, I tend to jostle and vary, like, movements, lengthening. Notice I don't say stretch quite as much, lengthening, moving stuff. And then I'll come in for another compression. They seem to be able to take that more easily. It would kind of be like doing a 2-hour deep tissue. But it's a kind of deep tissue where you don't use any oil and you just go right into the spot without softening it first. It's like if you use a little bit of softening, then go in, you work on an area, back off, lengthen, mobilize, reassess, go back in again, then you usually take that a little bit easier. Do you guys want to try that, just to me?
So what if the table's a little too high and you're short?
Yeah.
So some people, total variables when it comes to table based. How many of you have a hydraulic table? Absolute best. If you're going to stay on the table, you've got to be hydraulic. It gives you the most options. Do you raise it lower while people are on it?
Yeah.
Ton, tons of options, right? Changes some of the physics. The table, if it's high enough, now I'm taller than some of you, which means I can still get my knee up. Here's the thing, if I'm in this position, my hip to my knee is down. That's better, that's why I prefer mat work. Compression, gravity, I relax, sink in. If the table